Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs. Welcome to this week's episode. I'm your host, Jenny Wetter, and my pronouns are she, her. So, y'all, it is the week of New Year's. Somehow this year has been the longest year. Like, when I try and think back to January, it feels like those things were a lifetime ago. How is it almost 2021? It's so, how can it be both? It's like this weird combination of this year feeling just like it was never going to end and days feeling like they're taking forever. And yet, looking back and going, I can't believe it's New Year's already. I'm not really sure how that dichotomy is holding up, but for me, it has been both, right? This year has been so long. I think back to traveling at the beginning of the year. You remember that when we would go places and see people? And I'm so glad that I got to do a little tiny bit of traveling at the beginning of the year. It really helped, especially at the beginning of quarantine, to have done a little bit. I went to Florida for a podcast conference, and then I spent a week in Curacao lying on the beach and reading, and it was delightful and really what I needed at the beginning of this year. But it really helped me get through the start of this. And so, after that, it's been not much has happened, right? What could happen? I've been at home, mostly, me and the two cats and lots of baking. And I've stuck with my New Year's resolution last year, which was to bake more things that scared me or I was intimidated by. And I did really good on that this year, right? I made bagels for the first time, which were scary. I did my own sourdough. I started my own culture and baked sourdough bread, which was really something I'd wanted to do for a long time, but had been really intimidated by. And being home because of the pandemic, I was finally here for a long enough stretch to start it and not be intimidated. So that was exciting, and I really enjoyed the sourdough. I made English muffins, which were really intimidating to me because, a baked good that you don't actually bake, you cook on a griddle, that's really wild. But that was fun. I maybe will try one more thing before the end of the year that has, not intimidated me, because that's definitely not the right word, because I think after conquering some of these recipes, I'm not as intimidated by them anymore, except pastry. Pastry still intimidates me a little bit. I'll have to get to that. Maybe that'll be next year's resolution, is to try pastry. Yeah, that's it. Next year, I'm going to try pastry and not just stick to bread. But I think the one thing I want to do before the end of the year is make cinnamon rolls. I don't know that they intimidate me versus not having the counter space and wanting to do all the effort to make cinnamon rolls, but I think that's going to happen before the end of the year. So there we go. I conquered last year's New Year's resolution, and I figured out what mine for next year is going to be, because I had no idea until this just came spilling out. So pastry. Next year, my goal is to do some pastry stuff, because that one intimidates me, but I will get there. I guess watching all of this Great British Baking Show has really paid off, right? It convinced me that I should try bread, and now that I should do pastry. So that's fun. Other than that, nothing too exciting. It was hard not being home for the holidays. Like I said, this was always a big thing for my family. This will be the first time I've not been with my family for Christmas, and only like the second time that we haven't gone to Christmas Eve with the whole big family. And the other two, I think, were both due to like major weather things that we didn't want to drive like the hour and a half in ice. So that's sad. But everybody's safe, so that's what matters. And I was able to talk to my family, my parents, on FaceTime, which was lovely to get to see them and talk to some friends. So it was okay. It was a little weird being here. I did the same thing I did at Thanksgiving. The little restaurant near me had Christmas dinners you could buy. So I bought a Christmas dinner and made that, and it was delightful. I might do the same thing for New Year's. So we'll see. This year has been long, but I'm looking forward to the things to come in 2021. There's a vaccine, things to celebrate. And now I have this new challenge. I'm going to make pastry. And with that, I think maybe we'll turn to this week's episode, because it is kind of long, but really important and really exciting. As I said, we usually do a year in review episode, but that just felt terrible for this year. Like, who wants to look back on all the terrible things that have happened this year? So we are going to talk about the Reproductive Health Rights and Justice Blueprint, which is the reproductive health rights and justice agenda for the new administration, the things we want to see happen. So it's proactive. And y'all, it feels so good to be talking about proactive things versus just like playing defense and trying to put out all the things that are on fire, because everything was on fire. So I was really excited to have with me Caitlin Horrigan from Planned Parenthood Federation of America and Planned Parenthood Action Fund, and Michelle Batchelor with In Our Own Voice. So thank you, ladies, for both being here and talking with me today about the blueprint. So enjoy our conversation. Hi, Caitlin and Michelle. Thank you so much for being here today.
Thank you for having me.
Hi, Jenny. Great to be with you.
So before we get started, would each of you like to take a second and introduce yourself and include your pronouns? Let's go with Michelle.
Hi, I'm Michelle Batchelor, and I am the Vice President of Government Affairs at In Our Own Voice, and I have a plan going over National Black Women's Reproductive Justice Agenda, and I use she and her pronouns.
Hi, I'm Caitlin Horrigan. I also use she and her pronouns, and I am the Director of Global Advocacy at Planned Parenthood Federation of America and also Planned Parenthood Action Fund. And it's really great to be with you to be talking about a proactive agenda after 4 relentless years of attacks.
Yeah, I'm so excited. So normally we do like an end of the year look back on all the things that have happened that year. And that just felt horrible this year. Like, why subject ourselves to that? And so I thought, let's do the proactive agenda because it's so much more exciting. So maybe we'll just start with the really basic. The agenda was set in the blueprint, but what is the blueprint?
Sure. Well, the blueprint really lays out a comprehensive, proactive domestic and foreign policy agenda to achieve sexual and reproductive health, rights, and justice. And it lays out a vision for the future that we want to live in. So clearly that is not our reality today, but we're one which every individual has sexual and reproductive autonomy over their own body. And importantly, the blueprint provides a playbook for how to get there. So this was drafted by Planned Parenthood Federation of America, In Our Own Voice, and 90 of our closest coalition partners. And it was publicly released in mid-2019. And I think it came out of a recognition that there is so much work to be done and that no one of us can do it alone. And that this moment presented an urgent opportunity to really come together as a community and to develop a cohesive agenda that really reflects reproductive health, rights, and justice and lays out a future that we dream of and that we know is possible. So it sort of reflects that tension in reality that there's both a tremendous amount of work to undo from the last 4 years under the Trump administration, but also the urgent need to make progress for health rights and justice for communities that really have never fully enjoyed those things. So the blueprint was drafted with the expectation that it would be implemented as soon as we had a supportive Congress and administration. And folks know that, of course, there are a couple remaining Senate elections, but what is clear is that we have an American public who supports sexual and reproductive health and rights access, and thankfully a majority in the U.S. House, as well as an incoming Biden and Harris administration who are deeply committed to championing these issues.
Yeah, and I think I would just add, as Caitlin said, it is 90 plus organizations, which is that have coalesced around, shared principles, and it is the various movements, both at national and state. And I think that's what really makes this so powerful. Speaking as a reproductive justice organization, it really is a comprehensive plan and recommendations that are very clear and cut across the issue areas. So it's not just about reproductive rights, but it also in with that includes, the social justice issue, the racial justice issue, economic justice issues. And I think that's why we're really excited to be able to share this with the incoming administration and feel really confident that this is going to be a useful tool for them.
And as I'm sure our audience can imagine, this is a very broad agenda with lots of things to be done. So I think we'll start by talking about, they kind of got grouped into principles where there's like 5 overarching principles that all the actions are grouped under. So let's start with the first one, which was to ensure sexual and reproductive health care is accessible to all people. So that's pretty basic, but also really big.
It is really big, but I think as we reflect back on the interesting year that is 2020, I think this is the time for it to be for us to really talk inclusive. As we think about who disproportionately is impacted by inequities, communities of color, particularly Black women, Indigenous people, LGBTQ communities, Latinx, could go on, who is historically disenfranchised from systems. This is the perfect time for us to coalesce around what it means to be able to truly have access to reproductive services. And so, as we think about, addressing, and now that the country is ready to really embrace our history of racial, ethnic oppression, this is the time to talk about how access impacts STD rates, how it impacts access to contraceptives, and not just access to the contraceptives that are traditionally promoted among communities of color, but it's about equity and respecting people's choice to choose what they and how they want to control their reproduction and their sexual health as well. And so I think, the first principle of access is really key, because there is, what good is a right if you don't have access?
And I'll maybe just add that I think another exciting thing about this principle is that when we say all people, we don't just mean everyone in the U.S., but truly everyone around the world, and that we're recognizing that the U.S. has a huge role to play in access for communities around the world, and frankly, that we have a long history of neocolonialist policies that have really undermined those rights and access around the world. So just another important add to that principle to kick off the document.
Yeah, and you're right. It's so big because so many people for so long have been blocked from accessing what is supposed to be a right. So I guess the next principle deals with discrimination and barriers. Who wants to take that one?
I mean, I think we're both so used to talking about it because it really is a big part. And I think, we have the opportunity to really go deep on what it means to be able to remove discriminatory barriers. I think, for us, yes, we definitely talk about race and ethnicity, but I think, we have an opportunity with the incoming administration, hopefully with Congress, to talk about rural communities, to talk about people with disabilities and the access that they have and respect for their reproductive choices. And so I think, we're particularly excited about this opportunity, but I think that at times it does feel daunting because discriminatory barriers have been so ingrained in our culture and system that I don't even know that we're always aware. And so I think what the blueprint has really tried to do is really, dissect it, take it piece by piece, and looking at how our systems are creating barriers to access, how they are particularly disenfranchising communities in different ways. And I know Caitlin has other thoughts on this, but I think this is a key piece. Until we remove these barriers, we're not going to get very far. We're going to continue to see, health disparities. We're going to continue to see the gap, the economic gap between the haves and have-nots continue to increase. And so I think, out of particularly, obviously I'm biased, out of all the principles, I think this one is really key to being able to successfully, impact people's lives and to be able to make the necessary systemic changes.
Yeah, I think that's exactly right. And to Michelle's point, I think we see forms of discrimination really layering on top of each other, so that when we look at a policy like the global gag rule or the Helms and Hyde amendments, which erect barriers to abortion access in the US and around the world, I think we see it's the communities who already face systemic barriers to care who are disproportionately harmed by these policies. So, the global gag rule is hitting hardest with young people, with LGBT communities, with adolescents and young women. It's folks that are already struggling on multiple ways to get access to care, who then are doubly hurt by the imposition of these harmful policies.
Yeah, I especially appreciate Michelle surfacing people in rural communities, because I feel like that's one that is not talked about quite as much, particularly in the US context. And as somebody who grew up in a rural area and didn't really know where to go to get care, that it's a huge barrier for people.
Yeah, I do think, it's just such a challenge that, because if you think of rural communities, I guess I don't have to tell you, but it's as simple as transportation. How the heck are you going to get to the clinic that's, in some states over 100 miles away, and particularly as community health centers are being attacked and underfunded, not funded. States are coming up with more and more creative ways to restrict that access. It's going to be the rural communities that are going to have the greatest challenge in being able to even just get to the clinics.
Okay, so that brings us to the third principle, which is around research and innovation, which I think a lot of people don't necessarily think about.
Caitlin, I don't want to feel like I'm always, going first, but I think, particularly thinking about communities of color and other communities that have, disparities. I think the research aspect is particularly important to us, because if we really are going to address the systemic issues, we really need to know what the frame is. We need to know, who these populations are, what the makeup is. I think, the real meat of it, though, is that it can't just be researchers. Like, there has to be equity in even this data collection and how we're framing things, and is the research inclusive of the communities that we want to highlight and understand better, and I think we're seeing this, somewhat with the vaccine trials for the coronavirus, in that, communities of color don't necessarily feel inclusive as part of research, and there's a lot of hesitation to even participate. And so I think there really has to be a concerted effort to engage with communities of color, so that they are part of the data and the growing information we have on how policies, how programs are structured, how, without that, I think we'll just be spinning our wheels. And so I do think that was a very important part to include with the blueprint.
Yeah, and on the global side of things, I think when I think about the importance of a robust research agenda, I think about the 218 million women in developing countries who want access to modern contraception to prevent or delay a pregnancy and aren't yet using it. And I think part of why that's happening, I mean, there are many reasons, but one of them is the lack of a method that fits what they want, concerns about side effects or questions about their fertility intention. So I do think we constantly need to be challenging ourselves and the research and science community to develop options that better work for people in their reproductive lives. And I also want to underscore, I think, Michelle's point about the need to have communities who are at the front lines of experiencing challenges really to be part of that research and science agenda. They shouldn't just be the recipients of care and development, but actually be an active part of developing a research and science agenda, so that when we do get new technologies, it matches the realities of people's lives, and that they have been an active and vocal partner in making that a reality.
Yeah, and I think that you're starting to see some of that coming out, and that's so great to see, but there's such a long way to go yet. The next principle focuses on ensuring health rights, justice, and wellness for all communities. That again seems like such a big concept. So maybe want to break it down into what are we talking about?
Not to be too basic, it's not just abortion. We're talking about the whole person.
Yep.
We're, particularly when we're talking about wellness, when we're talking about justice, I think, as I was saying earlier, it is the full lived experience of people, and so I think, Blueprint Coalition took the responsibility very seriously of making sure that we're framing the wellness piece so that it is inclusive, as I mentioned earlier, of, the choices people are making are not about just who they're having sex with and their uterus. It is about how am I going to pay my bills? How am I going to get my medication? If I do start with a particular contraceptive, will I be able to, will insurance, Medicaid continue to cover it? How does this interact in my life, as Caitlin was saying, what are the side effects? Are we, and then I think it's also, in that principle is the the cliche of nothing for us without us. And so, if we are serious about reproductive equity, gender equity, social justice and wellness, then we really need to be talking to the individuals on the ground in the community to find out exactly what that looks like for them. Because what it looks like to me may be very different than someone in a rural community or, in the West where they are truly a minority. And so I think that is a key component. And I also think that wellness piece has to be included, that it's not just wellness is not just my uterus, it is my being.
Yeah, to me, this principle really challenges us to think more holistically about individuals and what they need, not only to survive, but to thrive. And I think globally, there's long been talk about integrated programs, but I think this principle really tries to make that more alive and to push back on the notion that you can tackle things in silos, right? You cannot achieve women's economic empowerment without also thinking about their experiences with violence and their access to healthcare and their situation at home. So I think really pushes back on the notion that you can pick and choose amongst which issue to grapple with in someone's life, and that it isn't a win if you save them from one thing and then they suffer on another front, that we have to deal with them together all at once, and we can't just do the easy things. We also have to tackle the really deeply ingrained hard stuff. So I think the Blueprint does a good job of really laying out a vision for a comprehensive look at what that policy agenda means and needs to be for people.
So that brings us to our last principle. And I think this one's different, but also one that really has a huge impact on all of the rest, right? And that's ensuring judges and executive officials advance this agenda. And again, I think this is something people might not think about right away when they think of this, but again, are so important.
Yeah, I agree. Sorry, Caitlin, go ahead.
I was just going to say, I think inherent in this principle is that we can't achieve our policy vision without the right people in place. And I think, the last 4 years have taught us a lot of things, but one of the things it's taught us is that we need to think more broadly about the people and positions that can really affect our lives and our health and our rights. So the Blueprint, I think, takes a broader view on really pushing that we need sexual and reproductive health rights and justice champions throughout a government, both at the federal level and in the judiciary, because we've seen the really profound ways that people in a variety of positions have really relentlessly attacked and undermined those rights. And so through the Blueprint, I think, are trying to raise the bar that it's not just the Secretary of HHS or the Secretary of State, but we need champions throughout to really understand in a personal and deep way and are committed to prioritizing these issues and leveraging their power to advance these critical issues.
Yeah, and I think, what I would add, obviously, as you both have stated, the significant impact of the courts. And I would say, for communities of color, for Black individuals, for Latinos, it is very important for us to consider, and that the executive branch and the Senate approve judges that understand the reproductive justice frame, understand that we can't have freedom, we can't be liberated if we're not safe in our own communities. And their role as judges and in these roles is to ensure justice. And we have seen kind of what has felt like a hostile takeover of the courts, which is very concerning for, I think, communities of color, because unfortunately, it has not felt like the courts have been a resource or a safety net for us where we could actually find justice. And so I think there really has to be some intentionality from, now that with this new administration, with the 117th Congress, to really ensure that the the judges that are appointed, as well as the courts themselves, are held accountable to really provide blind justice, which I don't know that we've always felt has occurred. And so as part of reproductive justice, there can be no justice if we can't also be protected by the courts.
Maybe the only other piece I'll add on that is I think, Biden and Harris had put forward a really important vision to put an administration in place that looks more like America. But we also want an administration that reflects the American public's strong support for sexual and reproductive health and rights. So I think that's also a critical component of building an administration that looks like America. We know that public support is there, and we want that also reflected in the people in power.
Okay, so now that we've got the big principles out of the way, let's get to the nitty gritty of what are some of our early priorities for this administration? And I guess start with the immediate, like what do we want to see on day one?
Yeah, well, on day one, we really think that President Biden must issue an executive order that really, I think, demonstrates from the get-go the administration's commitment to sexual and reproductive health rights and justice. And we see this as including many things, but on the global side, must include eliminating the global gag rule, which we know has been radically expanded under the Trump administration, but frankly has been wreaking havoc around the world since it was first introduced in 1984. And we want that executive order to also really be proactive and directive towards agencies and departments, that they have to get out the word to the rest of the world. It can't just be a decision in Washington. We need to make sure it's felt in communities around the world and really made real to change programs and policies. And then the other big component that we're pushing for on the global side is for them to expand U.S. foreign assistance support for abortion to the maximum extent allowed under the law. So when we look at something like the Helms Amendment, we know that we ultimately need Congress to repeal that, and we're pushing for it too. But the Biden administration can take immediate action to implement exceptions to allow U.S. funding to support abortion, at least in the case of rape, life, and incest. So that's an action that they can and should immediately take. And I'll turn it over to Michelle to highlight some other domestic components of that day one executive order.
Yeah, to add to Caitlin, we really want this administration to come out clearly and boldly that they are committed to comprehensive sexual and reproductive health care. And so with that, a lot of terrible things have happened over the last 4 years. We want them to rescind the executive order of 535 and with the ACA, and make sure that that there is access, funds are available for abortion. We do want them to really, as we're in a pandemic, to lift the FDA's in-person dispensing requirements for MIFI, and we want not just for during COVID, but we want that to be permanent. So we want them to instruct HHS to make that permanent. Unfortunately, as Caitlin was saying, we want the day one to really instruct the agencies that we are pro sexual and reproductive health. This, current administration has put in things like taking out just those words. We need to put them back in. We need to make it very clear that that is going to be the course for the next 4 years, at least.
Okay, and that's a really bold and exciting ask for day one, and I really, really hope we see it.
Yes,
because it's important. And I know another part on the international side is focusing on getting the U.S. more involved in repro at the UN. Caitlin, do you want to talk a little bit about our asks around the United Nations?
Yeah, thanks, Jenny. So separate from the executive order, but still a priority that we see is hopefully happening on day one, is really re-engaging with the world when it comes to advancing health and rights around the world. And by that, we mean doing things like re-entering the World Health Organization and restoring U.S. funding to that critical entity, which, is a horrible move on its own, but really profoundly dangerous in the midst of a global pandemic. We also think it's critical that they restore funding to the United Nations Population Fund, often referred to as UNFPA, and that's the UN's Sexual and Reproductive Health Agency. That plays a critical role for so many communities around the world, including in really dire crisis and conflict settings, to make sure that reproductive health and rights are a reality. And then, Jenny, as you said, sort of fundamentally, we really want the U.S. to come back to championing sexual and reproductive health and rights at every chance possible at the UN and in other international forums. I think that proactive agenda is contingent on them doing a few key things, like clearly disbanding the Commission on Unalienable Rights, which I know you've covered on this show before, and really disassociating from some anti-abortion policies and documents like the Geneva Consensus Declaration that have been pushed under the Trump administration and really have put us on the side of human rights abusers and regressive government. So I think we need to proactively assert that that is no longer the rule of the day, as well as doing things like restoring reproductive rights reporting in our human rights reports. And I'm sure there's a even greater laundry list, but those are a couple of quick things that I think we could, that the Biden-Harris administration could do to really signal a change in policy and tone on the world stage.
Okay, so I think the next big thing of asks is around the budget, which will be coming up, which feels like so fast. So what are some of the things that we need the administration to do in their budget?
So we do have quite a few asks for the budget. As you can imagine, I think first and foremost, we want a clean budget that, ends the Hyde Amendment and ensures everyone has abortion coverage. And I think with that, we want to, I don't know if we want to go into specific dollar amounts, but we definitely want increased funding for Title X family planning programs. And we have several other budget asks that include the global family planning and reproductive health programs, that includes global funds for fighting AIDS, tuberculosis, and malaria, with the PEPFAR program, NIH, which, obviously right now in the middle of the pandemic is pretty important. We'd like to at least double their budget for research and development, which, if you recall, is one of our principles, and restore navigator funds and marketing funds to promote open enrollment for the ACA, and remove any anti-abortion language that's included with that. Teen pregnancy prevention, the personal responsibility education program. So these are all included in our ask, including maternal, child, and health block grants and CDC Safe Motherhood and Infant Health Initiative. So we do have a lot of asks. I do think we want elimination of unnecessary restrictions, the Livingston Amendment, and funding for abstinence-only programming for sure. And so I think that the Biden-Harris administration has indicated in their plans that they've made public that they are in support of all these programs. We just need them to be funded at capacity. That's our biggest ask.
Okay, after budget, another big area that we already kind of touched on a little bit is personnel and making sure we have the right people in positions taking actions. That's
right. Yeah, I think we think that the Biden administration must select sexual and reproductive health champions for both the executive and judicial positions. And that's both ones, as Michelle said, that would require Senate confirmation, as well as people that they'll appoint into the administration. On the global side, I think we've already seen a couple of early intents to nominate key positions like Secretary of State and U.S. Ambassador to the UN. And I think, these are early opportunities to, I think, signal that the U.S. is ready to restore global engagement and to really prioritize sexual and reproductive health and rights. But it's only the start. And there's a ton of more work to do, but we're excited, hopefully, to welcome more sexual and reproductive health champions in the coming weeks and months. And really, hope that we can work with folks like the U.S. Ambassador to the UN and USAID Administrator and U.S. Global AIDS Coordinator to really move the ball forward on sexual and reproductive health and rights, and to assert those as winning issues, that people can be proud to champion those issues and to prioritize.
Yeah, and I think we're feeling pretty encouraged because, as Caitlin said, the incoming administration has indicated that they want their cabinet and they want the administration to reflect the country. And I think, we're seeing that to a certain extent with the nominees that have been named so far. I think the Blueprint Coalition is actively engaged in being as helpful as we can for the incoming administration and identifying those individuals that are ready to serve starting day one, that represent racial and ethnic minority groups that as Caitlin said, supportive of sexual and reproductive health rights and justice. And so we are actively engaged, and the incoming administration is receptive to that. And so we are feeling pretty strongly that there will be people in the administration at various levels that will speak to the priorities of our communities.
So I think one of the other areas is Congress, but we'll get to them in a second, because I think there's one more. I'm going to cram two together, bucket of things, and that's regulations that need to be stopped or policies that need to be changed. I know they're different, but they're kind of similar, so we're just going to go ahead and cram them together. That's also another big ask because there are a lot. So maybe some of your top priorities in that area.
Yeah, there are a lot, and they're growing every day.
Yeah.
As far as the things that need to be rescinded or brought back, I think, for us in the RJ community, we're definitely focused on it. I think the Blueprint has really laid out very well many of those that including like the public charge, and because that has significant impact for immigrant communities and their access to health care, religious exemptions, as we've seen this week with the case with Vermont and with California. It's still a thing, and it's harmful for communities of color to be denied health care because someone that has chosen to serve in a particular capacity does not deem it important and does not see it as a priority. The DACA recipients' pre-existing condition insurance program plan is particularly important. And then I think we're definitely, have seen attacks on the ACA. And I think we really need that to be a priority for the administration and Congress to protect that, because that, without that, I think the last statistic was like 20 million people would be stripped of insurance, and most of those would be people of color. And I think that we have to protect that. I think, and with that, non-discrimination in health and health education programs is particularly important. And so we need, as laid out in the Blueprint, we need the Section 1557 of the Healthcare Rights Law to be revised so that those protections are there and interpreted to protect all people.
Yeah, I'll also add that a huge priority is, of course, reversing the domestic gag rule, which really decimated the integrity and evidence-based Title X domestic family planning program, which had previously served nearly 4 million people, the vast majority of which had low incomes. And something we're watching is a last-ditch attempt by the Trump administration to expand the global gag rule in another unprecedented way through regulation. In this instance, they're trying to attach it to global health contracts, which is another way that a huge chunk of global health programs are funded in the field. So if that does get signed into place before inauguration, that's another big priority for a reversal of a regulation.
Okay, that brings us to the other huge area that needs to be tackled, and that's Congress, because as much as we may wish that the Biden administration could just wave a wand and fix all the things, they can't. So what do we need Congress to do?
Well, one big priority for Congress is that they really can and should pass the Global HER Act as an immediate action following what we hope is the rescindment of the global gag rule by the Biden administration. And the Global HER Act would make that repeal permanent so that a future president couldn't come in and once again put the policy back in place. And this really feels so urgent. As I talk to partners around the world, they're excited that Biden will come in and take the action, but they always ask, well, what's going to happen in another 4 years, or what's going to happen in another 8 years? And I think in order to build sustainable progress, we really need the policy gone once and for all. And it's Congress who can ultimately do that by passing a law like the Global HER Act. And we know that it's actually supported by 70% of the American public who also want to see that policy gone. So I think there's both urgency in the field and support from the American public for Congress to get this done. I think there are other, complementary efforts that Congress can pick up that we hope the Biden administration also champions, like repealing the Helms Amendment, which is sort of the global complement to hide really restricting and undermining abortion access around the world. And for 50 years, the policy has been, again, wreaking havoc around the world and really undermining and exacerbating the crisis of maternal mortality and so many other issues of health and rights. So we hope Congress does take action to end that policy once and for all.
Yeah, and I think, Caitlin just mentioned the Hyde Amendment. We need, like we're asking the president, we need a clean budget. We need, it's been 40 plus years that, restrictions to Medicaid funds for abortion has been voted on in the affirmative. And it's too long, it's harmful, enough damage has been done. And so I think collectively as movements, we are adamant that the Hyde Amendment must no longer appear in any appropriations bill. I think also we definitely want the Breathe Act to be approved. We want to see the Voting Advancement Rights Act that John Lewis was leading on and had been for probably far too long. And I believe Representative Sewell has introduced that, or had in 2019. So we need protection so that, that people's vote, we need to protect our democracy, and the Voting Rights Act is part of that. And then I think we really need Congress to continue to work with the advocacy community. And I think we will, we're currently engaged, and with the new Congress, we will be engaged to really work with them to put forth legislation from this point on that speaks to the values of the country. And the country has been speaking really since this summer that we want justice, and we want our policies and our legislation to promote and reflect equity. And so, we had a Hyde hearing, was that this week, last week? I don't know my weeks now, but and it was the first, I believe, in at least a decade, if not more. And I think, what really resonated was the fact that, like, this is a really discriminatory policy. This is hurtful. And if we truly are going to address inequities in this country and dismantle these systemic barriers, then that is the best place to start, because that is so harmful for communities that have been disenfranchised for generations now, is to remove those barriers, to create access so that people can make the choices that are best for them, for their families. And so I think, collectively as the blueprint, that's really what we want to see. We want to see systemic barriers just, crushed. And I think we are very adamant that we are going to hold our elected officials accountable. And I think we've seen that in the most recent election, and I think we'll continue to see that.
Okay, so that brings us to the ever important question we always ask at the end, is what action can our audience take? What can they do to make this a reality?
Well, I hope everyone gets some collective rest. This has been a hard 4 years, but also don't let up on telling elected officials that you want sexual and reproductive health rights and justice protected and really expanded, both in the US and around the world, and that these must be priorities from day one. And I want to highlight that Planned Parenthood Action Fund has a petition that folks can sign to the incoming Biden-Harris administration that really asks them to prioritize much of what we've talked about here today. And you can add your name really easily. Just text add me to 22422 to sign on. So that's an easy way you can jump in, and I'm sure more actions to come.
Yeah, and I think, there are big and small ways for people to participate, but I think the overwhelming thing is we have to participate. So if that means voting, which is the most important, powerful thing we can do, and very basic. It feels very basic, but yet we keep seeing, new barriers being placed. But I think so that is one way for people to participate, to get involved. I think there's always an opportunity, and I think it can be intimidating, but I think as people are seeing things, hearing things, concerned about things, they should reach out to their elected officials and hold them accountable. And I know it can be intimidating, but I think once they, do it the first time, it gets a lot easier. I think that's one way. And then I think people running for office. I think that, we need more people running for office, getting involved, in their local, state, political systems, I think is a very important way for people to engage. And I think, we see it, we've seen it over the last few years with people, AOC was not political. Cori Bush, who's coming into the 117th, was an advocate and realized that, she can have real influence and real impact by running for office, and she won. And so I think others can do that. And as we have more people in decision-making powers, we have a better opportunity of the needs of community being represented and reflected in our different systems.
Well, Caitlin, Michelle, thank you so much for being here today. I had so much fun talking to both of you about a proactive agenda and no longer playing defense.
Yeah,
absolutely. Thanks, Jenny.
Yeah, thank you.
Okay, I hope you enjoyed the conversation. Like I said, it was so nice to talk proactive things. Oh, it's so exciting. I had a great time talking to Caitlin and Michelle. And let's see. Oh, before the end, if you're still listening, don't forget we're still running our birthday giveaway. So if you reach out to us on social with the hashtag Happy Birthday rePROs, or just comment on a post and tell us what your favorite episode is, or what you love about the show, or a topic you would like to see covered, you will be entered in a giveaway to win a bunch of rePRO swag. And there's a lot of fun stuff in there. A fun tote bag, a pop socket for the back of your phone, coffee mug, notebook, pens, a bunch of fun stickers. So if you enter, you can win all of it. And we'd love to hear from you. So feel free to reach out to us in whatever way you would like on social. You can find us on Facebook and Twitter at rePROs Fight Back, and on Instagram at rePROs FB. And with that, I will see you all in the new year. Happy New Year. For more information, including show notes from this episode and previous episodes, please visit us at our website at rePROsFightBack.com. You can also find us on Facebook and Twitter at rePROs Fight Back, and on Instagram at rePROs FB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.